Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding.
Okay, so let's talk about two things that seem separate but are actually and kind of scarily connected. The way you sleep and your risk of having a stroke. This relationship is way more serious and tangled than most people ever realize.
So let me just ask you this straight up. Could the way you sleep every single night, something we all do, be a huge risk factor for one of the worst medical events you can imagine? Well, the science is clear on this, and the answer is a resounding yes. And this quote right here, it really nails the core of the problem. It's not a one-way street. It's not just that bad sleep can lead to a stroke. A stroke can then turn around and absolutely destroy your ability to sleep. It's this vicious cycle. And today, we're going to break down both sides of it.
All right, so let's start with part one. How does this whole dangerous thing get started? How can something like a pattern of bad sleep actually physically increase your odds of having a stroke?
Well, the main culprit here has a name: sleep-disordered breathing, or SDB for short. And the most common version of this is obstructive sleep apnea. You've probably heard of it. Just imagine this. All through the night, your airway keeps getting blocked. You stop breathing for a few seconds or even longer, and your body has to panic and jolt itself awake just enough to get you breathing again. And the craziest part? You might not even know it's happening.
So, how big of a deal is this really? This number says it all. A major study found that if you have severe obstructive sleep apnea, your odds of having a stroke or even dying are 3.3 times higher. And that's even after they accounted for other risk factors. That is not a small number. That is a massive red flag.
And what's so telling is that it's not like an on or off switch. It's a scale. You can see it right here. The worse your sleep apnea gets, the higher your stroke risk climbs. It's a direct link. More severe breathing problems mean more severe danger.
So, you might be wondering, what's it actually doing to your body? Well, over time, SDB is like this silent saboteur working on your cardiovascular system. All that nightly struggling for air leads to chronic high blood pressure. It makes your arteries get stiff and hard. Basically, night after night, it's creating the absolute perfect conditions for a stroke to happen.
And that's the long-term damage. But this is what's happening every single night. It's an all-out assault on your brain. Your oxygen levels plummet and then shoot back up. Your blood flow goes haywire. Your heart can get knocked into a dangerous rhythm. It's no wonder that so many strokes happen in the early morning hours, right at the end of this nightly battle.
Okay, so let's flip the coin. We've seen how bad sleep can set the stage for a stroke. But now let's talk about what happens after a stroke. Because a stroke doesn't just damage the brain, it can turn around and cripple your ability to sleep. Just look at this number. It's staggering. When researchers looked at over 2,000 stroke patients, they found that 72% of them had sleep-disordered breathing. Let that sink in. This isn't some rare side effect. For the vast majority of stroke survivors, it's the new reality. The stroke itself can actually cause these problems.
And here's how it happens. A stroke can cause obstructive apnea by literally damaging the part of the brain that controls the muscles in your throat, making them weak and floppy. But it can also cause something different, called central sleep apnea. And that's a signaling issue. The brain itself forgets to send the breathe signal to the body. So you have a physical blockage problem on one hand and a communication breakdown on the other.
Now this is so important. Why does this matter? Because getting bad sleep after a stroke isn't just about being tired. It actively torpedoes your recovery. People with SDB are more likely to have a worse outcome, they stay in the hospital longer, and, get this, they're at a higher risk of having another stroke. It even messes with neuroplasticity, which is the brain's amazing ability to heal itself.
Okay, so we've laid out this pretty grim picture, right? This dangerous feedback loop where sleep problems and stroke just keep feeding each other. But here's the good news, and it's really good news. You can absolutely break this cycle.
And the way forward is actually super clear. It all starts with getting screened. In fact, it's now recommended for everyone who's had a stroke or a TIA. From there, simple things can help, like just trying not to sleep on your back. But really, the gold standard treatment is something called CPAP. It's a machine that helps keep your airway open all night so your brain and your body can finally get the rest and oxygen they've been starving for.
And if you want to know if treatment works, just listen to this. One study showed that for stroke patients, using a CPAP machine was linked to a 5-fold reduction in things like having another stroke. 5 times. That isn't just a minor improvement. That is a life-saving, game-changing result. So when you boil it all down, here's the real takeaway. Taking care of your sleep, especially if you're a stroke survivor or at risk, isn't just a nice to have. It's not about feeling a little less tired. It is a powerful, active way to protect your brain, prevent another disaster, and give yourself the absolute best shot at a full recovery.
So I'll just leave you with this final thought. We track our blood pressure, we watch our weight, we think of those as vital signs. Well, sleep is a vital sign too. Every single night, it's sending you messages about your health. The only question left is, are you paying attention?
Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.